In today's video, we're going to be talking about the temporomandibular joint, the TMJ. T for TMJ. If we look at the TMJ, it is comprised of a skull bone as well as a jawbone. So the temporal bone is this bone outlined in blue right here, and then the mandible is this bone outlined in green here. Those two bones coming together make the temporomandibular joint. As you can see here on the right picture, the mandible is in blue, the temporal bone is in white, and then this red circle circles the TMJ, the temporomandibular joint. Inside the temporomandibular joint, we have an articular disc. As you can see, here's the face here, there's the TMJ. If we do a close-up, we can see that there's a disc in between that mandible and temporal bone. So that disc provides a little bit of cushion as well as provides the joint to glide as the mouth opens and closes. We can look at the abnormal positions of this disc, and it also gives us some insight as to why we will have pain, why we'll have clicking, why we'll have locking of the joint. So with the disc, as we open the jaw normally, that disc is going to kind of slide forward as the jaw hinges upon that disc. If we have a clicking sensation when we're opening the mouth, that disc is positioned in front of the mandible, so that mandible clicks over top while opening and looks something like this. If we have a locking of the joint, then again that disc is going to be positioned forward, and as we try to open the mouth, that disc is going to prevent the jaw from opening completely, and it'll have a locking type sensation with that disc. If we look at the muscles around the temporomandibular joint, all these muscles help with different motions of the jaw. So opening, closing, moving the jaw from side to side, as well as protruding and retraction of the jaw. So each of these muscles, we have the temporalis muscle up here, we have the lateral pterygoid, the masseter, we have the infrahyoid, the myohyoid, the digastric muscles, and medial and lateral pterygoid muscles. So all these muscles, each of them provides a different motion, and if we have abnormal motion within the temporomandibular joint, the TMJ, then it can be caused by dysfunction within these muscles. Some of these muscles may be too tight, so it's pulling the jaw more in one direction than the other. Oftentimes we'll see if someone has a tendency to chew everything on one side, those muscles will be a little bit more developed. So the jaw can be pulled over to that side, and you can start to develop some arthritis or some wear and tear on this TMJ, temporomandibular joint. It can have some wear and tear on the disc that we mentioned in the previous slide. And it can also have an effect on where that disc is positioned. And like I showed in the previous slide here, if that disc is positioned differently, then we can have clicking as well as locking of the joint. So this disc can be positioned differently due to trauma as well. So if you had a blow to the jaw, that disc can be displaced a little bit, as well as a repetitive stress injury. So people that do chew on the one side consistently over and over and over again, you're putting more stress on the one side of the joint compared to the other side of the joint. So when we do an analysis to check to see what is going on with the temporomandibular joint and what's causing it, we'll have the patient open and close their mouth. We'll feel the joint to see if there's popping or clicking or restriction within the joint. And that gives us an idea of what's going on with the disc between the two bones, as well as what's going on with these muscles. If some of them aren't functioning correctly, there are some things that we can do from an exercise standpoint, as well as a soft tissue mobilization, and well as joint mobilization standpoint in the jaw, as well as the neck and even the thoracic spine, to help with making sure that this motion is restored properly.